do have a guest here with us today. Welcome. Let's have you go ahead and introduce yourself, and then we can talk a little bit more about what we're going to talk about this morning.
Sure. Hi, everyone. I'm Deborah Fernandez-Turner, and I'm the Deputy Chief Psychiatric Officer for CVS Health, and I'm a child, adolescent, adult psychiatrist.
Awesome. Welcome.
So we know obviously heading into January, a lot of people make their New Year's resolutions. One of them, I think, especially coming out of the pandemic, has been prioritizing your mental health and your mental well-being. On the other side of that, though, we kind of saw this shortage, I feel like, after the pandemic of mental health officials, support specialists, staff, psychiatrists, therapists. I know that a lot of people are having trouble accessing those resources. So I wanted to talk to you a little bit about, first of all, how do people start their year on a better mental health journey? What are some things that we can do in our everyday lives? Yeah, just to make a big difference.
You know, absolutely, and I love that you all are asking this question, right? So if we can focus on our mental health from the beginning, everything else falls into place. It makes it so much easier to, you know, just to live every day if you focus on your mental health. I think a great place to start is assessing where you are. And a good way to do that is through some mental health screeners that you can find online. The CVS Health app has one, cvshealth.org has one, but there's lots of free screeners online that anyone can access. At least if you know where you are as far as your own mental health, it's a great place to start. And then you can start setting goals that allow you to expand on that from there.
And I think it's really, we hear about it all the time. You know, people having all these big goals on January 1st. It's now the end of January almost. So what advice would you give to those folks who maybe are like, I'm over it, I just can't do it anymore?
Absolutely.
What would you say?
You know, it's so interesting. Many people set goals at the beginning of January feeling like it is something miraculous. You know, January 1st is this miracle day where you can flip a light switch and change your whole life, right? Well, I'd say if you set a resolution, and at this point, about 60-70% of people are really not holding to those resolutions anymore. If that's the case, take a look at the resolution. You know, is it really something that that really speaks to you? Is it something that is really important to you? But even beyond that, is it maybe something that's too big? You know, a lot of people think that they can do this wholesale change on January 1st, but really, it's good to set long-term goals, but maybe that goal that you set for January 1st should be a long-term goal as opposed to something that you can change with a light switch, you know? So breaking it down into little pieces, making small changes, and then if you really need to make a change in your lifestyle, it's really important to understand where old behaviors and patterns come from. You can't change or get rid of an old behavior unless you understand how it served you. And then you can hopefully replace that need with something that may be a little bit healthier for you.
So for people that are thinking maybe in the new year their number one priority is mental health and they want to get support, whether that be a psychiatrist, a therapist, just somebody to talk to, what's the best way for somebody to go about even finding those resources?
You know, it really depends on where you're coming from, right? A really great place to start is if you have an employee assistance plan, give a call to that employee assistance plan. Many of them have numerous free sessions that are available to anybody for multiple reasons, and it doesn't have to be pertaining to your work. And I think that's something that people don't realize, is that your employee assistance program is there to support your whole mental health, not just your work conflicts. So start there, right? And use those free sessions that are available to you, and they're usually set up in such a way that you have faster access. And again, no copay, so that makes it really accessible. After that, they will be able to connect you directly if you need further assistance beyond that employee assistance time frame.
And for those people who maybe they feel they're experiencing these feelings, but they kind of have that stigma around mental health. I know the past couple of years, a lot of people have really been trying to break that. And especially after the pandemic, we talked a lot about how mental health was so important. What advice would you give to those people who maybe they're a little nervous about reaching out, they don't know how to feel about it, they don't even know where to start?
You know, it completely makes sense. Taking that step it can be a big step, and it can feel really overwhelming. opening up your personal feelings to a stranger is not a normal thing to do. So acknowledging that and saying, yes, this isn't easy. This is really hard, and it's okay. But we can do hard things, right?
Yeah.
And so finding that way to connect with something where you do feel comfortable. So, again, that CVS Health app, you can do a screener, but then also you can connect to mental health services directly through the app. And it's a virtual service, just like going to the Minute Clinic, right? You can go to a virtual Minute Clinic if you're not feeling well. You can do the same thing with a therapist through the CVS Health app. And I think most people don't even know that even exists.
Yeah.
But it is available here in Arizona.
And I think that's made such a big difference too, because people can stay in their own space. And we've kind
Exactly.
of gone into this, I guess, generation of Zoom calls and doing things virtually.
Exactly.
And so I think that's opened up the door for people who maybe don't want to go into a therapist's office, because for some people, I mean, it's uncomfortable
Scary.
going into a different space
Exactly.
where you're not familiar. So you can stay in your own home, and it's easier to access for people.
Absolutely. And if you're not driving a half an hour there and a
Yeah.
half an hour home, you can do it during your lunch hour. You can, and this way nobody really has to know.
Right.
It
Yeah.
can, if you really feel it's important for you to maintain that privacy, that's completely normal. It's totally understandable. And that's one way to do it, is to access it through an app, whether it be the CVS Health app, or there are lots of alternatives out there for virtual care. And oftentimes, those virtual care services are easier and faster to obtain. So,
Okay. Well, is there anything else you want to talk about or mention, or any more tips, or
yeah,
feel free.
I think that the most important thing for people to remember is that mental health is health.
Yeah.
And just the same way as someone would check their hypertension, check for diabetes, just that same way, I really encourage people to check on their mental health, and to do so with an external help, whether that be
Okay.
a screener or a therapist or with your doctor. But checking in on yourself, sometimes it's really easy to lie to yourself. It's really easy to trick yourself. Hey, I'm fine, I'm okay. It's really easy to do that. But
For
if you ask yourself those questions and answer honestly on a screener, you might find something out that you hadn't realized. And I encourage everybody to get the help that they need sooner rather than later.
Well, and I think the same thing can be said about therapy, because you tell your family members your problems or your friends, and you obviously shape them in a certain way because you know how they're going to respond. But for as much as people fear about talking to a stranger, there's also something therapeutic about talking to somebody who you're like, they can't judge me. I don't have to see them
Yeah.
every single day,
Yeah.
Exactly.
and they don't judge you.
Exactly. There's a lack of judgment, but also therapists are trained to ask the right questions.
Okay.
And to probe in a different way. And so with that becomes a really important tool to use in your personal growth. So it doesn't even have to be that you're diagnosed with a severe depression or diagnosed with severe anxiety. It's okay to see a therapist to learn more about yourself
just check in.
and to grow. Yes.
Yeah, just daily little
Absolutely.
tools, because
Yeah.
we all have our quirks, we all have our things
Absolutely.
that we could probably do without.
Yeah.
So
Absolutely.
perfect.
Well, thank you so much. We
Thank
really appreciate
you.
you being here. And honestly, such great advice.
Thank you so much. Thanks
Thank
for
you.
having me.